Do not move this man until you examine him. He may have a broken bone. If he has, he will feel pain and tenderness at the site of the injury. He may have felt or heard the bone snap. There may be swelling or deformity. If there is any doubt, treat the injury as a fracture. Handle the arm carefully. When a bone is broken, any movement causes extra pain and can damage surrounding tissues, blood vessels, muscles, and nerves. The aim of first aid is to avoid further damage by preventing movement of the broken bones. Steady and support the injured arm with gentle traction. Secure it, even if only in a temporary way, before he is moved. Apply a splint from knuckles to elbow to immobilize the bone ends and the wrist. A folded newspaper or magazine will do. If you use a hard splint, pad it to fit the arm to prevent discomfort and chafing of the skin. Secure the splint with bandages above and below the fracture. Avoid tying knot over the site of fracture. Support the forearm in a sling. This will ease the pain and keep the elbow from moving. Place the point behind the elbow. Carry the ends around the neck, raising the hand above the level of the elbow. Tie at the side of the neck. Fasten securely at the elbow. Leave the fingers exposed so you can check for signs of poor circulation. When the upper arm is fractured and the elbow can be bent, the arm may be immobilized by an arm sling and broad bandages. Support the forearm in a sling. Place a soft pad between the upper arm and the chest. Secure the arm to the chest by broad bandages above and below the fracture. Direct or indirect force on a joint, for instance, a fall on the outstretched arm, may cause a bone end to pop out of its socket. This is known as a dislocation. It can happen to any joint. When treating any dislocation, do not try to replace the bone end back in the joint. Support the arm in the position which the patient finds most comfortable. Use a tubular sling. Place padding between the arm and the body. Secure the arm to prevent movement. Use broad bandages, not too tight. Material handling equipment presents many hazards. Everyone must be alert and follow safe work practices if accidents are to be avoided. Do not move this man until you examine him. If you suspect a fractured leg, steady and support it. Apply gentle traction at the foot. If you find bleeding, expose the wound. If there is a bone protruding or a wound leading into the bone, it is an open fracture. Cover the wound first to prevent further contamination. Pass a bandage under the leg. If a bone is protruding, build up a pad around it. Bandage carefully. Avoid direct pressure on the fracture. When the wound has been dressed, immobilize the fracture before you move the casualty. Pass bandages under the leg. One at the ankle, one above the fracture, and one at the knees. Pad between the legs. Use the good leg as a splint. Move it to the side of the injured leg. Tie a figure-of-8 bandage at the feet and ankles to prevent rotation. Always tie this bandage first. Tie the other bandages snugly, but not too tight. Always tie knots on the uninjured side. Maintain traction until all bandages are in place. Watch to be sure that bleeding is being controlled. Fractures in the upper leg, in the hip or thigh, may not cause deformity at the site of the fracture, but the thigh may swell quickly. In some cases, depending on the site of the fracture, the leg rolls outward with the foot lying on its outer side. Serious internal bleeding under the skin and shock often accompany fractures of these large bones. First aid must be prompt and correct. Steady and support the injured leg at once. Pull firmly and steadily on the foot. Align the injured leg with the good one, toes and kneecap pointed upwards. The person at the foot controls the movement. Slide bandages under the legs. At the thigh, at the knee and below the fracture. At mid-leg. And at the ankle. Place a pad between the legs and move the good leg to the injured one. Tie a figure-of-8 around the ankles and feet. Remember to tie this bandage first. Now tie the remaining bandages. Always tie knots on the uninjured side. Do not bandage directly over a fracture. If the journey to medical aid will be long or rough, use a wooden slat or pole well padded as a splint. Apply it to the outer side of the limb from foot to armpit. Let's review. When in doubt, treat as a fracture. Steady and support the injured part at once to prevent further damage. Treat the fracture on the site of the incident before you move the casualty, unless life is endangered. Immobilize bone ends at the site of the fracture and the joints immediately above and below it. With dislocations, do not attempt to replace bone ends in the joints.